Hi, myself Dr. Arifa Patel from Dermatrix Clinic. We'll be talking today about hair transplant. So let's talk about the hair harvesting techniques that are done. The most oldest and the first transplant types were done were FUT, which is follicular unit transplantation. Okay, in that what would we do? We would take the hair from the scalp area. We couldn't take it from any other area in that area. We take a strip of the hair that is required, and then the strip is segregated into small grafts under the microscope. The fat, the skin, the hair, what all is taken away from the FUT technique was segregated to get your individual grafts. In this technique, we would get more grafts in lesser time of extraction. This was followed initially. Later on, there came a technique called as FUE, which is follicular unit extraction. Whereas you can take your hair from the back area, which is the donor area, we can take it from the beard area, or you can take it from the chest area. This helps us better because the people who have lesser hair on the scalp at the back area, which is the donor area, we can take the hair from the beard as well as the chest. So there are days also where the surgeons prefer doing both the techniques simultaneously. So if you need more hair grafts, like if you have a Norwood thinning in the 5, 6 and 7 grading, you would take from the FUT technique as well as the FUE technique. The advantage of FUT technique is the quality of the hair that you get in a lesser time. So the number of grafts that you get in one extraction can be more as compared to the FUE technique. So your process of taking more sessions of transplantations will reduce over your lifetime. One of the cons of the FUT technique is it has a visible scarring. So if a patient goes bald for whatever reasons, the scar will be visible even from a distance. So that's why people are more preferring the FUE than the FUT technique. Now let's talk about the FUE technique, which is known as follicular unit extraction. So there are different machineries used. Initially, the only thing that was used was manually, where we had big punches and we used to use around 4 mm punches, twist the graft physically with our wrist, and there were chances of high transaction rates. So then they came up with motorized punches. The motorized punches are what we call as the robot punches. The robot, the artist, the robotics, the NeoGraft or the smart graft machines, these are the machines which do the robotic hair transplants. But again in this, you have to have a manual interventions. So again, the results vary of the extraction. Thirdly, and the most commonest nowadays which is used are the other techniques, which is like the Vaz, the Trivellini and the Exilis technique. So in this, it's much more control on the surgeon's hand. So there are less transaction rates. So the less punches also are there because the size of the punch is much smaller as compared to the ones which are used in the robot or in the manual. The other technique or the most advanced techniques now that are used with the FUE machines are the Vaz, VWAW or the Trivellini or the Exilis treatment. Okay, in this what happens, the surgeon has more control. So it is much better in the extraction point of view. It's the result oriented and even the healing is faster of the area from where the hair or the graft is taken up from. Okay, the punches size are smaller. So hence the scar also will be smaller. In the manual as well as in the robot one, we had larger punch sizes. So hence the scar was even more visible. So looking at these pros and cons, we prefer doing the latest technique. Now we have to see how you prepare the donor area or the scalp area. There are different methods how you do it. So you have from the least visibility to the more noticeable area of the graft where the grafts are taken out. Now let's talk about preparation of the donor area from where we are going to take your hair grafts from. So we have it from the least noticeable to the more noticeable. There are different ways where the hair is prepared. The graft, the donor area is prepared. So the least one that we have is we keep the hair longer. But this will take more time consuming because you take the entire area of the hair and you implant the entire length. So of course you get an exact effect of the FUE, how is it going to look after 6 to 8 months, but we can do less number of grafts as it is more time consuming. Okay. The second technique that we do is the individual trim. So where your donor area is trimmed to a shorter length. So when the hair are implanted, they are not as long as your existing hair, but they're a little shorter. So you have like a stubble growth in that area. Thirdly, what we do is we take a part of the area of the donor area, where we can take either the topmost part or the center part of the donor area. Again, in this, what will happen? We have limited number of grafts. We will not get the desired number of grafts that we want, so your number of sessions of doing the procedure increases. Lastly, that you have is a band trim. Band trim is what is easily followed while doing a female hair transplant. You take some of your long hair, you lift it up, and you take a small patch from the back area, you trim it out, and from there those short hairs are taken which are just implanted. So when you are going back to work, your back area looks normal because above you have longer hair which covers the donor area. The most preferred technique is used as a complete shaving, or what we call as a full shaving, where the entire donor area is given a zero cut. So the surgeon or the doctor is getting a wider area to extract your hair from. So that becomes very easy for the doctors to pick up, to go around, so that your density at the donor area doesn't reduces drastically. Now let's talk about why do people prefer doing more of FUE than the FUT. So why we prefer the FUE harvesting? We prefer the FUE harvesting because the scars is much less, or it is not visible to the naked eye. Whereas in FUT, there is a long linear scar which is easily visible. Second, the recovery. The recovery in FUE is very short. Okay, and compared to the FUT, the recovery is a little longer, a little more discomfort. You have sutures where the patient has to come back again for suture removal. So that's a little more time consuming. Thirdly, what we can see is for the eyebrows. Now, if you have to do an eyebrow hair transplant, the FUE is more preferred because we can take finer hair from the nape of the hair, which is not possible in an FUT technique. Now let's talk about why the FUE technique harvesting is preferred more compared to the FUT technique. In the FUE technique, there are no visible scarring. So you don't see a scarring since the punches are very small in size. We use around 0.7 and 0.8 mm size punches. Whereas in FUT, there's a long linear scar. So when you have a short hair, or you have a crew cut, or you could have a bald look, the scar is easily visible. The recovery time in the FUE technique is much faster because there are no cuts. In FUT technique, there are sutures or staplers which are used. So the recovery time is much longer. The discomfort to the patients is much longer. Also, in FUE technique, there's a wider area given to the doctors or the surgeons to extract the hair from. Whereas in FUT, there's a limited area that the strip is taken out from. Once the strip is cut, we cannot recut another strip on the same day. We have to wait for the next session of the surgery. In case of eyebrow transplants, we prefer the FUE technique because we can take finer hair from the nape of the neck as compared to the FUT technique. So the quality of the nape of the hair is very similar to your existing eyebrow hair. Most of the doctors prefer doing the FUE technique for eyebrow hair transplant. Lastly, now let's talk why certain doctors, mostly the doctors from old school of thoughts, prefer the FUT technique than the FUE technique. They prefer because they can get number of grafts in one session as compared to FUE technique in the extraction process. What I mean by that is I don't have to spend around 2 to 3 hours only in the extraction process of the FUE if I have to remove around 3000 grafts. If I do a strip technique, I can do it in another 20 minutes because I have to just cut a strip of the hair. So the extraction process is much shorter as compared to the FUE technique. So when the patient is also lying down, he has to just lie down for some time as compared to a more time in an FUE technique. Secondly, the cost also of the FUT technique is much lesser expensive compared to the FUE technique. Cost-wise, if we compare, the FUT is less expensive than the FUE technique because the patient is not lying in the position for a longer time. The extraction time takes lesser. Hence, the costing also reduces. Now that we know both the techniques, the FUT and the FUE technique, there have been cases, or we have even heard and seen cases where the doctor prefers doing both FUE and the FUT technique at the same time to the patient. That could be because of the quality of the skin of the donor area. So certain times the doctors have to take a call whether they want to do only one technique or they want to do a combination of both. If you want to know further about these techniques, you can subscribe our channel and you can get more of the educational videos on these techniques as well as the other techniques that are done at the Dermatrix Clinic. Please subscribe us.